Hey everyone, I'm Kayla and I did my YouTube presentation on cerebral palsy. Cerebral palsy is a developmental disorder and it's also a congenital disorder that affects muscle tone, posture, balance, and bodily movements. Cerebral stands for having to do with the brain, and palsy stands for weakness or problems using the muscles, and this disease typically affects young children. The incidence and prevalence of cerebral palsy is that it is the most common disability in children. About 500,000 children and adults are affected, and about 8,000 infants and around 1,500 toddlers are diagnosed yearly, and about 1 in 323 children are diagnosed with CP, and it's also more common in boys than girls. Some of the behaviors of individuals with CP include just that it affects daily functioning of these individuals, such as their posture, balance, movement, communication, eating, sleeping, and learning. And some of the statistics that I found was that 1 in 3 are unable to walk, 1 in 4 cannot talk, 1 in 10 have a severe vision impairment, 3 in 4 experience pain, 1 in 4 have epilepsy, 1 in 2 has an intellectual impairment, 1 in 5 has a sleep disorder, and 1 in 3 has a hip displacement. Some of the interventions for those with CP include medications and therapies. However, there is no known cure. Medications can reduce symptoms and pain, such as muscle relaxants, which are the most commonly prescribed medication. Surgery is also an option to improve mobility, and there are several therapies that are available, and these include speech therapy, which helps with language, eating, and drinking, physical therapy, which improves mobility and coordination, occupational therapy, which helps individuals adjust to different environments, such as their home and their work environments. Recreational therapy builds social skills with their peers. Behavioral therapy provides coping mechanisms for emotional troubles. Hippotherapy uses horses to increase balance and muscle strength. One adapted physical activity goal that I decided to choose was aquatic therapy because there's been many benefits to those who have attempted or tried it, and some of these include um, the reduction of tension and stress on joints and muscles. It increases cardiovascular fitness. It allows for a wider range of movement, and it provides a comforting and soothing environment while the individual still can obtain the appropriate amount of physical activity. And the types of aquatic therapy include aquatic yoga, motion exercises, breath control exercises, and balance exercises with flotation devices such as pool noodles. And the goal that I chose would be to have an individual with CP do this for about 2 to 3 times a week for 30 minutes during each session. And this would allow the individual to have enough time to work on improving skills for the following sessions and improve on what they worked on prior to their current session. But the severity of the disability may range in individuals, but consistency will increase their muscle strength and coordination over time. And aquatic therapy is enjoyable yet physical simultaneously. And I also did my abstract paper on this, and so I found it pretty interesting that individuals with CP could obtain so many benefits just being able to do different exercises in the water.